60 seconds, guess the diagnosis, and as always, answer at the end. Let's go. You're working as the surgical registrar. Kimberly is a 29-year-old female patient brought to the emergency department. The A&E team have noticed that her heart rate is high and she's experiencing severe abdominal pain. She's had several attacks like these over the last several years. Most have resulted in hospital admission, and on a few occasions she's had a gallbladder and her appendix removed. This time she's been complaining of pain which is really deep, causing significant discomfort. She's writhing around in bed and screaming in the department. Despite lots of analgesics or pain relief, the pain isn't settling. They've asked for an urgent surgical opinion. When you see her, she's sweaty, clammy, unwell. She's unable to make eye contact with you because she's writhing in pain. When you look at her pupils, they're pinpoint. She's warm to touch, and when you press over the abdomen, even from the slightest of touch, she's paranoid and petrified it's going to worsen the pain. You notice some surgical scars on the abdomen, and you're worried given her previous surgeries she might have adhesions or scar tissue underneath. You ask about bowels and she says she's been more constipated for a few days. You ask about other medical problems and she was under the psychiatrist because during one of these attacks she became psychotic. She was seeing and hearing things that weren't there. Since then she's been okay. Again, you look at the blood test. The full blood count is fairly normal. The kidney and liver function appears normal too. You can see that a urine specimen has been sent and this was negative for infection. When you examine her, there's another urine pot on the side. You ask why that's there. She says that this is for a pregnancy and other additional urine tests. You look at the sample again, it's very dark, almost black in colour, and she says the colour has changed over the last few hours. If I tell you this is a fairly rare condition, it's really important to diagnose as patients are often missed. They can have multiple surgeries which ultimately have no indication. A careful history can elicit this diagnosis. If I tell you your red blood cells carry oxygen around the body, within each cell there are 4 iron molecules. These are called heme. The iron molecules are really important. They're very reactive and they pick up the oxygen. Given this complex job, their makeup is very complex too. There's a very careful step-by-step process that takes the raw ingredients and makes a heme molecule, and then 4 of these are stitched together into a hemoglobin into a red blood cell that carries oxygen. If there's a problem with some of the proteins that make the heme, you get lots of molecules made which aren't heme and they don't function properly. Where these start to deposit cause symptoms, and often patients with this condition get skin irritation, can get neuropsychiatric symptoms, and also symptoms to do with chest and abdominal pain. The patient's partner looks at you and says, "Doc, what do you think's going on?" Correct, this is acute intermittent porphyria.